Here's what's interesting, I find. The periodic, they correspond to these little dips in the O2 desaturations right here. This is where she starts CPAP, but these don't stop.
I knew that I wanted to be a surgeon. I loved the idea of fixing people surgically. It made sense to me. When you think about it, everything from the head comes down to the body, and everything is controlled in the body by the head. And so all the nerves, all the blood vessels, the five senses, the eyes, the ears, taste, everything is centered around the head. And with that comes this delicate and just beautiful anatomy that is just really interesting. My name is Soo Lee. I'm a pediatric otolaryngologist at Boston Children's Hospital.
Open your mouth. Tilt your head back just a little bit. Perfect. Alright, I gotta tickle your tongue for a minute, okay? You are doing awesome. Good job.
Half of my practice is complex pediatric sleep apnea. So kids who have trouble sleeping at night because something in their upper airway is obstructing. Usually take care of that with tonsils and adenoids, but many children we find have persistent issues. And so this field really delves into what might be causing it and how we address that surgically. And then my second half is pediatric otology, so ear disease. A lot of kids have ear problems. One of the mainstay operations that all of us do are ear tubes, but some children have more extensive ear problems than just fluid or infections in the ear. So kids who have cholesteatoma, lesions, masses in the ears, kids who have damaged hearing bones, have hearing loss for other reasons. As an otologist, we do other more complex surgeries to try to address these problems, and ultimately with the goal of trying to preserve or regain lost hearing.
And if you look through the microscope,
Okay.
and you're gonna look straight down, you can see the eardrum, and in the kind of right in the center of the speculum, you're gonna see a hole. Take a look.
Okay.
For kids with obstructive sleep apnea, I want to see a kid have the ability to sleep the entire night, wake up refreshed, go to school, and actually behave and interact optimally because they've gotten good rest. And so many kids can't do that right now. Same with otology, kids who can't hear, kids who are dizzy, kids who have chronically draining ears and they can't do certain activities because of that. The ability to actually help them to attain that better quality of life for them, that's what makes it worth it.